Hello, this is Dr. Karen Harum, neurodevelopmental pediatrician, and I'm here with you today from Vibrant Children, a whole family solution for the autism spectrum disorders, ADHD, and other developmental disorders. So welcome to our blog. We're beginning a new series today called Healing Transformations in Autism. It's all based on the fact that the brain really has an amazing potential for healing. You see, many of my patients with developmental disorders have what are called static conditions of the brain. Other physicians believe that they are unlikely to change or make much developmental progress, but my perspective really is different because I believe that developmental disorders are treatable and the brain can be influenced and fortified to grow and to increase in function. I've seen it over and over. You see, many of our children have problems that remain under the surface, or a mystery, so to speak, until a very thorough search is conducted. And when all organ systems are treated, and these kids are understood from the biochemical perspective, we can make tremendous clinical gains. This blog series focuses on 6 autistic children, their unique profiles, and the healing solutions that have resulted in happier and healthier children. These stories are real, but the names have been changed to protect their identity. And I thank all of these patients for teaching me that developmental disorders are treatable and for reinforcing that the brain really does have an amazing potential for healing. So let's start with Dorothy. This is a story, a true story about nonspecific brain inflammation in infantile autism. There's a little girl, Dorothy. She presented to me at about the age of 3.5 with a story of infantile onset autism that was very severe. In fact, she had no meaningful language, and there had been no history of regression at 18 to 24 months of age. No adverse vaccine reactions, no evidence of toxin exposure. One could assume that really her condition was genetic and static, that is, untreatable. Her behaviors were extremely difficult. She was defiant, she didn't speak, but she screamed, and she was driven in her obsessions over water, resulting in flooding in the home. She was extremely hyperactive and driven, and she had some patches of eczema and chronic constipation, which is very common in this population, but she was otherwise healthy. She was using a cream for her eczema. Eating was so self-restricted and picky that she was given Pediasure on a daily basis. Well, I knew that allergies and inflammation were playing a large role in her condition based on her clinical presentation, and so I collected some labs to sort these out. By blood testing, she had allergies to dogs, egg, milk, so the Pediasure had to be discontinued and replaced with a more nutritious option and to get her off cow's milk. Other allergens were also avoided. There were markers of inflammation from her brain and markers of a leaky blood-brain barrier in the routine lab work. Once she was stabilized on Risperdal, an antipsychotic medication to reduce her dangerous behaviors, I began to treat the inflammation with a strong antihistamine and a short course of prednisone. These simple anti-inflammatory steps resulted in a really significant turnaround with improvements in language, toileting, attempts to communicate her ideas, and a good reduction in her hyperactivity. She was later put on herbal preparations known to reduce inflammation, such as curcumin and boswellia. Likewise, naproxen, an anti-inflammatory, has been used intermittently with good result. Ultimately, a second short course of steroid actually normalized a marker of neuronal injury in her lab work, and it dramatically improved her behaviors further. Well, many years later, Dorothy has been on multiple medications, and she receives intensive behavioral therapies in the special educational setting. She loves her siblings, she participates fully in holidays, and expresses her feelings to her mother in the comfort of her own home. If she had not made dramatic improvements with anti-inflammatory treatments, she would not be faring as well today and would require a more intensive out-of-home setting in order to meet her needs. You see, it was my initial impression that she would soon require out-of-home placement. So by paying attention to the basic science support of anti-inflammatory treatments in autism, and by using medications and herbals conservatively chosen for their anti-inflammatory properties, I believe that Dorothy is achieving her potential and will continue to make gains both in learning and in behavior. This case emphasizes the fact that by properly identifying the root causes, brain function can be significantly improved. In conclusion, the brain has amazing potential for healing. Well, thanks for tuning into Vibrant Children and hearing about Dorothy's healing transformation. If you have stories of your own that you'd like to share with me, please contact us through the website, www.vibrantchildren.com. We look forward to hearing from you, and thanks for tuning in to Vibrant Children.